Our next speaker, who I see is right, welcome. Dr. Gary Cheung is Senior Lecturer for the Facility of Medical and Health Science at the University of Auckland. And he's currently researching several aspects around dementia and ageing, including screening tools for cognitive impairment, driving dementia, and cognitive stimulation therapy, which we have recently started offering as part of our socialisation service. Cognitive stimulation therapy and evidence-based non-pharmacological treatment for dementia. Could you please make welcome Dr. Gary Cheung?
Good afternoon, everybody. I'm going to talk to you the next 20 minutes on cognitive stimulation therapy. Now, we've been working on this treatment for the last 2 years, so I'm going to use the next 20 minutes to summarize what we've been doing in the last 2 years. So first of all, I want to thank Alzheimer's Auckland inviting me to give you this talk. It's really a pleasure to talk to you about our work. Very to move the slide. So I'm going to talk to you about what is CST, so that's short for cognitive stimulation therapy. We'll tell you a little bit about what we did last year with Alzheimer's Auckland and Taupaki Gables, recently in West Auckland, trialing this treatment there last year. Talk about what we're currently doing, trying to advocate and implement CST in New Zealand. I'll tell you about our recent trip to the UK. And lastly, tell you what we plan to do in the next year or two around this treatment. Okay, so July 2013, just a little bit over 2 years ago. In fact, Alzheimer's Auckland invited me to give a talk 2 years ago in the SYmposium, and I was asked to talk about what are the benefits of early diagnosis of dementia. And I accepted the invitation because I thought, wow, I haven't done that talk for a little while, so it'd be good for me to look at the literature and reflect on it. And then I came across CST, and I thought, gosh, the literature says there's evidence-based, and there's certainly helpful for people with mild to moderate dementia. So 2 years ago when I came across this treatment, I knew nothing about it. I was ashamed. And I told the group here that why are we not delivering this treatment if there is this strong evidence base there? So the first thing we did was to survey across New Zealand using the National Dementia Cooperative Network and ask who in New Zealand is delivering this treatment. So we came back, it was only Hawke's Bay, this PhD, they were doing this treatment at the time. So certainly as part of our work is to connect with the clinicians in Hawke's Bay around this. So in September 2013, so shortly after the discovery, we went to approach TPO for a small bit of funding to trial this treatment in Auckland, because we want to disseminate the information. But before we can disseminate the information, we need to trial it and get a sense of how it works. So that's what we did from February to July last year. We trialed 4 groups of CST, 2 groups with Alzheimer's Auckland and 2 groups with Taupaki Gables. And we generated a report in December 2014. And if you just Google search TPO and cognitive stimulation therapy, that will take you to the website and the report. In fact, we have a website now. The address, I'll show you the address later. You can go onto our website and all these reports, got linked to all these reports. And certainly some of my slides are on the report, on the website as well, so you don't really need to take notes. In May 2015, we conducted the first training workshop for 20 people working with people with dementia, how to deliver CST. So this is a quick summary of what we've done. Going into a bit more details. So what is CST? So based on the concepts on reminiscence therapy, reality orientation, and cognitive stimulation. In the World Alzheimer's Report 2011, this treatment was described as as effective as the medication for dementia. So that is quite significant if the treatment made it to a World Alzheimer's report. In the UK, with the NICE guidelines, so NICE stands for National Institute of Clinical Excellence. So if your treatment made it to the NICE guideline, that really dictates how this treatment is delivered within in the UK. And the CST group in the UK, this is a treatment that's not new. I mean, the first randomized control trial came out in 2003 by the researchers in University College of London. So this is nothing new. So what they did a couple of years ago was survey, because after the NICE guideline, there's a mandate to use this treatment in routine clinical practice. So the UCL group did a survey a couple of years ago, and they found 66% of dementia assessment treatment services within the NHS deliver this treatment. So we're way behind. And it's evidence-based for people with mild to moderate dementia. It's a very structured program. I'll walk you through it. Maximum number per group, 7 to 8. So with small groups, 7 to 8 older people with dementia, mild to moderate, and 2 facilitators for each group. And it's 14 sessions, so the groups run 2 sessions per week for 7 weeks. That's the frequency for meeting. And each time they meet for an hour. And after the 7 weeks, you can go on to maintenance treatment. And there are different ways of delivering the maintenance treatments. So when we went to some centres in the UK a couple of months ago, they run maintenance treatment in a day centre, so the whole day. So I sat in a group in Canterbury, and a group of 10 older people with dementia with 2 facilitators, and they had a group from 10 o'clock to 3 p.m. Not quite whole day, but over those 5 hours, they have different cognitive stimulation activities right through those 5 hours, and they have that once a week. And some groups may want 3 hours a week. That's one group we went to, they did that too. Okay. So this is the beauty of CST as well. It can be delivered by anybody who works with people with dementia. So occupational therapists, psychologists, social workers, diversional therapists, nurses, and volunteers. So a good group of volunteers in the UK help with delivering the CST. Of course, they went through the training, and the training is not exhaustive either. I'll tell you a little bit about that shortly. So this is the structure of the session, the 1 hour session. So it's always starts off with it's the same format, because that reinforces the memory for people with dementia. So they start off with a group name. So each group, the group members decide the name for the group. Okay. Then they have a theme song. Again, that's decided by the group, and they sing the same theme song every time. Then they go on to use orientation discussion using a whiteboard. But there's a whiteboard in the room, and the facilitators put down the dates and the season and the place. Okay, just how good orientation. Because as I said to you before, some of the theory of CST is based on reality orientation. So they do that. And then the next thing they do is current affairs, looking at some newspaper and discuss 1 or 2 items. It's very interactive. So. And then they go on to the main activity. So if you're interested, well, you can come to our training workshop, but there's menus you can purchase, and through our website, that will take you to, there's a link to take you to how to purchase these menus. And they cost roughly $30 to $40 to get them posted from the UK directly. It takes about a week. So the other day I ordered 30 of these menus. Because we're running a workshop right in November, so we want to get that ready. But it only takes that amount of time. So if you're interested, the menu takes you through the 14 sessions, what you need to do each time for each session. So you have the main activity that's well described in the menu. and then you move on to the last thing is go back to the theme song and some reminders for the main session. So, thank you. Is the speaker working? Okay, so this is the part of, at the beginning, talking about current affairs. So the facilitators here have a couple of newspaper articles, and this is just a minute, and I'll show that to you to see that.
And
are they all?
yeah, there's accusations that he slept with a prostitute.
Well, they've been off.
So what do you think to that? Why does it seem to be this keeps coming up in the papers all the time?
Well, they want money, don't they?
You think is it the women that
right,
want
yeah.
the money? You think? Do you think they're attracted to the men?
Yeah.
No? That's very cynical, Agnes. You don't think they love them?
Like that. Of course they don't.
Eh? She was letting you like that.
What's
the question?
I was just saying, why do these
Yes.
stories keep coming up? Because this is quite a topical thing at the moment. Is footballers seem to be meeting these women a lot.
I don't think he wants it to be in the paper.
No,
I
he
think
probably
they
doesn't.
probably do.
One bloke
I think they probably do.
after 2 or 3 girls.
Do you think it's a
The
long
must be
term?
some.
You probably can see the board I mentioned, the orientation board at the back here. Again, within the group, the different degree of cognitive impairment within the group, and some participants participated more than the others. But what really get me is the groups I set in, half a dozen of them now, the participants actually know how well or how not well the other participants are doing in terms of their level of cognition. They really become a group and really gel and have that bonding there. And certainly that is part of the reason this treatment works. The next one. So this is one of the 14 themes, and this activity the main themes usually go for 20 minutes. And this time they're looking at faces and scenes. So the facilitator had 3 photos there. One of Princess Diana, one of Marilyn Monroe, and one of Louis Armstrong. And the facilitator is asking the participant their opinion and how are they different or how not they're different and so on. You can have a look at this.
Just two because they're kind of musical.
Yeah.
Is there any other? Who would you say is the odd one out? Maybe.
Well,
Maybe that's it. Who's your odd one? Who's the odd one out?
Oh,
here?
the odd one.
Diana.
Why would you pick her?
Yeah.
Why would you pick her?
Yeah.
Why is she the odd one out?
I think it's the odd one out.
That bloke. What's his
She did go with a bloke, yeah.
Yeah.
Does that make her the odd one then?
Royal.
So that's saying maybe because she's royal? Could be.
Because they're pretty, aren't
Because
they?
she's
That's
royal?
right, yeah.
What did you say, Irish, sorry?
They're pretty. Yeah.
What, the 2 ladies?
Yeah.
Yeah.
So is he the odd one out because you don't find him very attractive?
No.
Oh.
Well, he's not.
He's supposed to be.
He's got beautiful teeth.
And it's fun when people come to the groups, everyone's having fun. And I've been to the groups I've been to, everyone smiled. I can't, even though people with quite high cognitive impairment, they really enjoy coming. Okay. So, the feasibility study, so I'm not going to tell you too much of it, but certainly having that 4 groups last year gave us the experience of how CST works and what we need to do, what not to do. If you're interested, you can go onto that website and read the reports. I can't remember how many pages, but it's there. Okay, the next thing. Implementing CST New Zealand. So, my work, I work half-time for the university, half-time for Auckland DHB. And I don't know, you probably have people from DHB talk to you before. It's quite hard to implement treatment even within the public health system. So my research partner, Kathy Perry, she's the senior lecturer in the School of Nursing, we decided not to go to the DHB routes. We decided that, first of all, to develop a set of competencies, because I told you before, different clinicians from different backgrounds can deliver this treatment, and that a lot of the skills that practitioners already have, like for example running groups, a lot of occupational therapists already have their skills. So that's what we did. We developed a set of competencies. It's only 10, but that enabled us to match or map the competency to what teaching and learning activities we need to deliver when we run the workshop. In the workshop, it's only 1 day workshop, and it's not absolutely necessary for you to come to the workshop before you deliver the CST. Certainly in the UK, there are practitioners that read the menu and then here they go and give it a go after that. So we have training classes. So back in May, in Auckland, we trained 20 clinicians, and one of them, Michael from North Shore Hospital with the psychogeriatric inpatient unit, he started a group in the psychogeriatric inpatient, running CST for 4 days a week, from 10 to 11, I think, every day. So Kathy and I are going to visit them next Thursday. So we gave them a couple of months to try it without being the expert coming in and watching, and also talking to the staff there how that. Alzheimer's Rotorua started a group as well, so that's great. And we're running a workshop in Wellington in November, and the workshop's already full. We're only limiting that to 20 people. And that workshop, Mid Central DHB, going to send 10 people coming to our workshop. So we're using this bottom-up approach. We're not going to approach the DHB and say this is how a wonderful treatment. So we're trying to educate, well, that's why I'm coming to talk to you, educate everybody about this and enable people to know more about this treatment. These are the competencies. So it's 10 altogether, but there are 3 or 11. Sorry, I should know better. But the 3 main roles of CST practitioner are knowledge of dementia, because you need to know a little bit about dementia, how to deliver CST sessions, and also how to implement a CST program. So our training is wrapped around these competencies. And if you're interested, go on the website. This will be it. But that's the website, quite easy to remember, www.cstnz.com. So some of the presentations, I try to load them up there as we go. All the resources for the workshops are on the website. We're not secretive about the resources. All the PowerPoint and so on the workshop. You can go ahead and look this up. And, that's cafe. So we were having some stimulation in London. We're drinking cocktail. So we're very fortunate we got invited to present our work in New Zealand and the UK in the first CST International Conference at the University College London. So we were able to meet the developers of CST because we've been using their names, we've been quoting their names all along when we wrote the report. And it was such an amazing meeting and talk to them about their experience. We also went to Kent to look at the COTS clubs. That's the day centre I talked to you earlier. They run cognitive stimulation activities as part of their care facility, usually with Age Concern UK. And people, I think the participants pay something like £20 for the day. And it's run by volunteers, 2 volunteers run the groups. They're not health professionals. Okay. And that's the photo of me, just to prove I did go to Canterbury. If you're interested in the COTS Club, that's the website again. If you go to our website, that should take you through that as well. That's me over there. And the 2 facilitators at the back, Donna and the participants over there. Yeah. And what is next? We want to evaluate our training classes because it's something new we've started. So we want to follow, because often you come to workshop, you hear about a new treatment, and people go home and forget about it. Now, is that going to happen with us? Probably. But we want to follow up participants coming to a workshop and what happened to them. So we're going to North Shore next week, have a look. We want to go to Rotorua, have a look. Okay. The research, we're currently working with the academic physiotherapists in AUT, combining CST with physical activities. So this is a novel treatment, similar structure, having CST, but with physical activity too, because you probably already heard a lot about physical activity and cognition and how good physical activity is. And when we mentioned this to the CST developers in the UK, Amy Spicer, she's the brain behind CST, and she said, "Oh, yes, Gary, we didn't think of physical activity because when they developed the program in the late 1990s, there wasn't the same degree of evidence for physical activity and cognition. But now, in the last 10, 15 years, a whole lot of research came out about physical activity and cognition. So Amy is all for this. So we've got her behind us, and certainly she's part of the development team on this program. So in a couple of years' time, hopefully we can come back here and talk to you about that program. Individual CST, that's pretty new. The result just been out in UCL. So what they did was, because I told you CST is in a group, it's a group treatment. So the researchers in UCL developed a program for individual CST delivered by caregivers or family on an individual basis. Now they did find that the effect is not as good as group, because when you look at the literature, CST improves cognition, improves quality of life, improves communication. The individual CST hasn't got the same effects, but it does reduce carer stress. Now, what we want to do in the next year or two is, instead of having family members or carers delivering CST, can we look at other people outside of the family, or for example, we can use community support worker or volunteers to deliver the treatment. So that is something we like to do as well. And one of the other things I did the same talk to the diversional therapists a couple of weeks ago at the annual conference, so they're very interested. So we know in residential care, we already get diversional therapists working there. So they really want to learn, so we started to talk to them about running a workshop with them. Now, our role is to disseminate the information. We're not here to make money. The workshop does cost $100. That get us to pay for the menu, get us to pay for the cost of the venue. So just to tell you that there is a small cost attached to that, and just cover our cost of running a workshop. Diversional Therapy Organisation Australia also heard my talk, and they're very interested in embedding this treatment in Australia as well. So we just an email on Friday. We're going to do a Skype meeting with them and how to help. Because Australia, this is not really embedded in the treatment either. So this is an exciting time. So these are the people I want to thank. Sorry, run out of time. The Dementia Service Auckland in Hawke's Bay. We spent a day there and looking at the program a couple of years ago. Alzheimer's Auckland, Taupaki Gables, TPO, and also Sir John Logan Campbell Medical Trust funded the science trip to King, allow us to look at the treatment there. And my employee, really, School of Medicine, University of Auckland, also contributing some of the costs to run the workshop in Wellington in November. So thank you.